welcome to the PHPC, Public Health Physicians of Canada webinar, Communicating Data for Health Equity Action. I am Dianne Oickle with the National Collaborating Center for Determinants of Health, and we'll tell you a little bit more about us and what type of webinar this is as we go along here. We'll tell you that the session is being recorded, that we will share a recording of this session on the members portal for the PHPC, and there are instructions there as well for dialing in. You're hearing my voice, Dianne on the left. Our Knowledge Translation Coordinator is Asher Cortete, and Asher Cor is joining us from her home office in Montreal and is helping us with the tech in the background. And there's her email. If you've got any questions or concerns, you can email either one of us as we go along here. We are one of 6 National Collaborating Centers for Public Health, and this webinar is actually a product of the collaborative National Collaborating Centers for Public Health. So all 6 together we refer to as the collaborative. And I am located in Antigonish, Nova Scotia, and we are spread across the country. If you'd like more information about the NCCs, you can go to our website, nccdh.ca. And before I go any further, I want to most importantly acknowledge where I am sitting right now and where the National Collaborating Center for Determinants of Health is located. And we are within Mi'kmaq, which is the ancestral and unceded territory of Mi'kmaq people. And the territory is covered by the Treaties of Peace and Friendship, which Mi'kmaq and Wolastoqiyik peoples first signed with the British Crown in 1725. And we put this land acknowledgement up here as a standard part of our practice. We also include this with our printed products. And we're very, very grateful to be here. And I'm very proud to be where we are at St. Francis Xavier University. We also want to acknowledge that we have distributed staff across the country in a number of other Indigenous unceded territories, and we can certainly provide more information on specifics to those who are interested. This is to disclose that the planning committee for this webinar and this webinar series has no conflicts of interest. We also want to reassure that none of the presenters today have any conflicts of interest, and we have gone through a vetting process for that. We have had these slides reviewed by the Scientific Review Committee for the Public Health Physicians of Canada to ensure that there's no evidence of bias and that these slides and the presentation can be accredited for continuing ed credits. And certainly if you've registered and if you've attended, we'll email you a certificate. If you did not register, please be sure that you complete the post-event survey to request the certificate. Asher Core, I'm noticing some people say in the chat box that they're having trouble hearing. So wondering if you can help out a bit with that. Oh, and it's my volume you can't hear. Usually I have a loud voice, so I'm going to talk a little bit louder and a little more directly, and I hope that that's a little bit clear. I'm really sorry about that. So this is our first polling question. We're trying to get a sense of how many medical officers of health are on the line. So we're going to ask you to do a quick vote of yes or no here. We have developed this series, this webinar is part of this series specifically for the Public Health Physicians of Canada. And so that's why we're asking specifically how many of those we might have reached. So mostly no, which, you know, is not unusual. But thank you for letting us know. This is very, very useful. So a little bit of background around this series and the Public Health Physicians in Canada. Certainly many of you will know that there are competencies for MOHs in Canada, and there may be some public health physicians residents online that will be very aware of these competencies, and this series of webinars has been developed to help members meet some of those minimum competencies for practicing in public health specifically in Canada. Here's a little bit about our audience, the main audience of focus, but certainly we open these webinars to everyone, recognizing the benefit and the interest in the information for everyone that's out there. And I'm getting messages you can hear me a little bit better, so that's great. I'll keep talking much more loudly. So here is poll number 2. We'd like to know which of the best best describes you. So I'm going to leave it there for a second. And this is mostly other health professionals. So certainly if you're not a PHPC member, you're not a public health physician, MOH, MOH resident, you would be other. And again, it seems like that's probably the majority. But hopefully, and we're pretty confident that this will be relevant to you as well. And on to today's topic. So what we're talking about today is that we're communicating data for action on health equity. The focus is not so much on how to choose indicators. It's not how to analyze and interpret data. This isn't about you learning how to do all the steps of a health status report. It's really about recognizing where your work as a PHPM resident and public health and community practitioner on a number of fronts fits within this whole process of communicating data and reporting on data. What do you need to be aware of when your organization is working on it, and then identifying what you can actually do within your position to influence it. We're talking about how the data can be communicated in a way that actually leads to public health action to address health inequities. How can that data influence decisions and priorities in public health? How do we make the equity focus of population status reporting stronger? How do we do reporting in a way that's effective and makes the data really usable and understandable, and have some influence on public health partners and how they think and feel and act? Health status reports are sometimes called community assessment reports, community health reports. They can be a really important tool for public health practice, but they don't do a whole lot of good if they sit on the shelf and then never get used. And so, we've all heard that, what is measured is what matters. And so this is true, but just having the data isn't enough. And the way that data is reported can either heighten or really completely hide health inequities in the population's health. And since there's no real prescription for how to integrate health equity into reporting, and then how to effectively communicate those messages, that's what we're exploring today. And with that, I'm having a slight pointer problem. There we are. These are the 3 main objectives for our webinar today. This is what we've designed the content around and what we have aimed to do with the information today. As you are thinking about this webinar, and then as you fill out the evaluation, which is the link I'm putting up now, please consider those objectives that we repeated on the evaluation. Consider those and how we've met that. If you need to leave early, my suggestion would be open up the survey now. It will take you about 2 minutes to fill out. It's all electronic. It's also all anonymous. And we really, really do use that feedback to plan future events and future products that we offer. And another quick polling question to get a sense of what people's experience has been. Are you familiar with population health status reports? I've used reports, I've contributed, I have responsibility for reports. We really want to get a sense of where people's knowledge is on this. And experience, knowledge and experience. And also, as people are filling this out, I'll ask again for people to keep introducing yourself in the chat box and let us know where you're calling in from, and if you've got a group there with you, how many people are in that group, so that we have a good idea of numbers and who's joining us. So this is really interesting. It's a bit of a mix, somewhat evenly distributed, not being familiar, having used them, but then also, having responsibility and having contributed to development. So that's very interesting. Very, very good. Thank you very much. That's actually really helpful. And just to reassure you that even if you've not had a lot of experience or you don't do a lot of direct work, you can have and will at some point in your career have a role with this, and we're sure this will apply. So I'm going to do an introduction of our two speakers. You won't be listening to my voice the entire time. We have two people online today. The first person you'll hear from is Bruce Krentz. And Bruce is a decision support analyst with the Northern Health Region in Thompson, Manitoba. He has a professional background in recreation, community development, and health promotion. In real life, he's a father, he's a volunteer, TV and radio show host, he's a podcast producer, he's an athlete, musician, a woodsman, all things that he says he practices with varying degrees of success. You'll note here that he is not an epidemiologist, and yet he's going to tell you how he has a major responsibility for population health status reporting. After we hear from Bruce, we'll hear from Katrina Plamondon, and Katrina is a practice leader for research and knowledge translation at Interior Health in British Columbia. Her work there focuses on a health systems perspective. She is a registered nurse with a Master of Science in Community Health and Epidemiology. She's also in the final stages of a doctoral program at University of British Columbia. And that research is what she'll talk about today, and that's really focused on equity-centered practices for research, part of which is really specific to the knowledge translation for reporting data to influence action.